Hello again. I'm Jeff Meland from Digital Tech TV for Informed TV, and today we're going off topic a little bit from technology to mental health. And today I have Susan Meland, MD, who is a psychiatrist, to talk about seasonal affect disorder. And so thank you, Dr. Meland, for being here. I think we have a lot of people who will be interested in what you have to say about this. And as I understand it, seasonal affective disorder is a common problem in the wintertime, but we'll get into that. And so welcome, and nice to have you here.
Thank you.
Okay, a seasonal affective disorder, what is it exactly?
It is a mood disorder. Affective refers to mood.
Okay.
So it's a mood disorder which is varies seasonally. So winter depression, which is the topic that we will be talking about today, is a mood disorder or depression that has its onset in September, October of each year and resolves by March or April of each year. It's been recognized informally for many years, but it was formally identified in 1984 by Dr. Norm Rosenthal at the National Institute of Mental Health.
Okay.
And he has written a book called Winter Blues, which is a really nice resource, and written for lay people about seasonal affective disorder, particularly the winter variation.
Okay, great. We'll put a link to that book or mention it in our show notes as well so that people can check that out. For seasonal affective disorder, you might feel kind of down in the winter, and you might wonder if you have this disorder. So what do you think?
Well, the symptoms are basically the same as recurrent major depression. The difference is that the onset is predictable, that the onset is in the fall, usually September or October, and then remission occurs around March or April each year. But in terms of symptoms themselves, they're very similar, which can include low mood, a loss of interest, loss of enjoyment, decreased energy, hard time concentrating on things, feelings of hopelessness, that if they're very extreme, they can result in thoughts you'd rather not be alive any longer or thoughts of suicide. Some of the symptoms that are particularly characteristic of seasonal affective disorder, the winter depression variation, include craving of carbohydrates, increased sleep needs, having a hard time getting up in the morning, and weight gain.
Mm-hmm. Okay.
There's another version of seasonal affective disorder in which depression is worse in the spring and summer months, and in that situation we see some of the opposite symptoms, such as weight loss, increased energy, kind of a nervous energy, insomnia.
Mm-hmm.
So
okay, all right, that's a good list. And maybe we'll even list some of these on our show notes so that if people want to go back and review what they are, they'll have a reference that they can refer to. And of course, if you go on to Google and search for this, you can find all kinds of information as well.
yes.
So,
The cause is not completely well understood, but the theory is that with diminished sunlight and diminished hours of daylight, that causes a disruption in our internal biologic rhythm known as the circadian rhythm. And that in turn probably disrupts the biochemical, some of the biochemical processes, in particular serotonin. There also melatonin has been implicated. There may be a relative increase in melatonin secretion during the fall and winter months that can be associated with depression. And interestingly, melatonin is actually also potentially used to treat seasonal affective disorder in combination with full spectrum light. And then there is a hypothesis that the seasonal affective disorder may be an evolutionary remnant of hibernation.
well, that's interesting. Okay. So you can't really control your likelihood of coming down with this. It's just probably your chemical makeup that makes you more susceptible to getting it or not. But you can treat it. So when do we seek help if we think we have a problem like this?
And I should say, too, that you probably can, once you've identified that you have it, you can start treatment a little earlier than the symptoms typically occur, and then you can potentially prevent the severity of symptoms for subsequent winters once you've identified that. But in terms of when to seek help, you would look at the duration of symptoms and the severity of symptoms. To have an occasional low day here and there can be pretty normal. If your symptoms go on for more than a couple of weeks, if they cause a disruption in your well-being, cause a lot of distress, interfere with your functioning level, such as work or relationships, that is a time to get some additional treatment.
Okay.
And in particular, if the symptoms are so severe that you become hopeless, have thoughts you don't want to go on with your life any longer. I mean, of course, that can be an emergent situation that requires immediate attention.
Right, definitely. So, so if you go in and get treatment, what is the treatment then?
Well, there are some things you can just do at home. If you've identified that you most likely have seasonal affective disorder, maybe you've always dreaded winter and identify with some of the symptoms I mentioned earlier, there are some things at home that may be helpful for you, particularly if your symptoms are more on the mild side. For example, there's some speculation that vitamin D may help with the treatment of this disorder, although the jury's still out on that. Taking omega-3 fatty acids may be helpful. Those are, you can utilize foods that are rich in omega-3 fatty acids, such as tuna, salmon, or you could take a supplement in a pill or capsule form.
Like fish oil?
Fish oil,
Capsules.
yes.
Okay.
Yep. You could take St. John's wort, which is an over-the-counter antidepressant. You should not take that if you're also prescribed an antidepressant, because there can be drug interaction. Another over-the-counter antidepressant is called SAM-E. Some of the mind-body connection therapies, such as yoga, meditation, can also be helpful. Getting exercise during the winter months, spending a lot of time outdoors, can be helpful. Minimizing your alcohol usage, eating healthy, managing your stress, taking a vacation in a warm, sunny location can also be helpful. You're
rattling off a lot of items here, so we'll make sure that we include these in the show notes so that if you didn't catch everything, you can go back and find out everything that she just said. So, all right, treatments. We were talking about treatments.
And then other treatments that may involve the help of a professional would include the full spectrum light. Now, actually, you can purchase those yourself. We'll show you an example here that we have.
This is like a desk lamp, but it's really bright. So you plug it in there, and you can see how bright it is. Shine it right at the camera there, but it looks like halogen or fluorescent lights or something. I don't know, but it is very bright. Do you want to talk about the brightness?
Yes, and this light therapy mimics the intensity of sunlight, and this is a full spectrum light, and the intensity of the light is 10,000 lux, which is a way of measuring the intensity of the light. There are also blue wave lights and green wave lights that can be used. But with the light therapy, you would typically sit in front of the box facing it for maybe 20 to 30 minutes each morning. It's important that the light gets into your eyes, so don't wear sunglasses and don't close your eyes. You sit perhaps 12 to 20 inches away from the unit. Use it first thing in the morning. There's also another form of light therapy is the dawn simulator, and that is something you might attach to your clock or have at your bedside. It begins to turn on when at the point that the sun would typically rise during the summer months, and then gradually increase in intensity, and that's another treatment for the seasonal affective disorder. Psychotherapy can also be used.
Do you do that?
I don't do that. Usually that would be through a psychologist, and cognitive behavioral therapy is probably the most commonly used for seasonal affective disorder, where you identify some of your thoughts and behaviors that may be associated with depression and work towards replacing those with healthier thoughts.
What's your most common form of treatment for this disorder, or don't you have one? Is it just the whole range?
Well, in my practice, the full spectrum light and also antidepressant medications. We use those as well. The prescription medications, including Prozac, could be Zoloft, Wellbutrin, Effexor. Those are several medications that are commonly used. There's another medication, not an antidepressant, called Provigil, which is usually used for people that have excessive daytime sleepiness from a sleep disorder such as obstructive sleep apnea. That medication can be helpful with seasonal affective disorder as well.
Great. So there's lots of different treatments
Yes.
and for varying degrees of this seasonal affective disorder. Or say that right?
Yes.
Yeah.
Yeah.
So let's see. Let's talk about how this is different than depression, just for a moment. Or did we already talk about that?
We covered
Did we cover that already?
Yeah, very similar.
It's very similar.
It's very similar, but there are some symptoms that are more characteristic of seasonal affective disorder, particularly the increased carbohydrate craving, the increased need for sleep, having a hard time getting out of bed in the morning, and waking, and then the seasonal nature of it is also different than
but
regular
the symptom
depression.
itself is depression, right? It's feeling sad,
feeling low,
which is feeling low.
Yep.
Yeah. And when you should seek help, and should you go to an emergency room, or what do you have to say about that? Then?
Well, if your symptoms are severe, and particularly if you're feeling very hopeless, having thoughts you'd rather not go on with your life, and even specifically having thoughts of suicide, perhaps creating a plan in your mind or having a strong intention of carrying through with that plan, you should seek help immediately in that situation. Typically that would be your local emergency room. Also going to an urgent care, a clinic may be an option as well, or to a mental health facility if they have emergent walk-in appointments available.
Okay, that's good to know.
Yeah.
Oh yeah, for these lights, so where do you get these lights?
There are a few options.
And what are they called again?
This one is called the full spectrum light. There's also blue wave lights, green wave lights, and dawn simulators. And this one is from Northern Lights, which is an online company. The price typically ranges from $150 up to $300. You can get them at medical supply stores as well.
Okay.
You don't need a prescription to get a light like this, but in order for insurance to help cover it, typically in that situation, you would have been evaluated by a professional, formal diagnosis given, and then a prescription written. In that situation, the insurance company may pay for that as well.
Okay. Well, very good. I want to thank you, Dr. Meland, for coming in today. I think the information you have here is very useful to a lot of people, and so thank you for coming in, and we appreciate you spending the time, and maybe we'll have you back again for another interview sometime for another topic.
Thanks for having me.
Okay, thank you very much. And this is Jeff Meland for Digital Tech TV for Informed TV, and thanks for joining us today, and we'll see you next time.